are 100 and please be reminded that participants' microphones are muted throughout the meeting. For questions, to be joined again by Ms. Milton, Product Lead for the Digital Health Atlas, an open-source project registry designed to support governance and coordination of digital health applications. The DHA is a resource for government teams who are interested in understanding the current maturity, scale, and functionality of each and every project in your country.
Hi, everyone. This is Megan Orton from the World Health Organization. Cha and Alvin, thank you very much for the chance to share the work of the DHA again. After our time together with a number of leaders in Malaysia and Kuala Lumpur, we wanted to take the chance to follow up to look in greater detail at the types of planning steps you need to take if you want to prepare to deploy the DHA. And so again, I'll begin at the beginning with a little bit of a background on the DHA. On a very high level, the DHA, or Digital Health Atlas, is an open source digital health project registry. It's designed to increase transparency of your project activities. Both historic, current, and future projects are recorded. It's designed to allow a very easy visual analytical summary of the data. So it's a map-based summary of project location and activities, with an easy way to export all of your data. And it also allows you to improve the quality of the data. There's a shared classification framework called the Digital Health Interventions Classification Framework that is a shared language on the functionality that software uses, not just the title of the software or an overall configuration of a platform or system that uses more than one type of software. And finally, it enables governance and oversight. So the DHA, as mentioned while we were in Kuala Lumpur, has the ability for Ministry of Health teams to indicate on the map which projects are approved and which projects are pending approval and which projects are not under the purview or leadership of the government. So we may not take the whole hour, but I wanted to just overview the process that we recommend as the DHA. This has been based on the experience deploying the DHA now in close to 20 countries globally, in different regions between Asia, Europe, Africa, and North America. So the steps are around 7. They can be moved around. I'm sure that you've seen this happen with software deployments. But we found that these are those that you would want to ensure you are including in your operational plan. The first step is often selecting the core team, then looking at the certification as a DHA site admin. That's a service that we provide as the WHO, and a certification that we provide as the WHO. The next is looking at communication. So that's the briefing document for key leadership, a concept note that can be shared both to those key leadership teams and then also more broadly institutionalized through Ministry of Health, donor, and NGO partners. Designing a customized questionnaire, so looking at your informational needs, and then looking at how to communicate the premise behind the DHA, the goal as a governance mechanism within your country, and also the formal launch strategy. And then finally moving on to the launch of the DHA. So first and foremost, selecting a core team. We found that this works best when it's not just a technical team, but also your health-focused teams. And I recommend that those external teams, the health teams, are those that have the majority of digital health programs happening. They don't have to be technical themselves, but they often would be individuals that have a keen interest in advancing the coordination of digital health programs, and then also those that have a keen interest, so those that are kind of personally interested and have begun to maybe explore digital health programs. The next is looking at aligning the individuals on your team with broader health strategic priorities where possible. So one example is we have a country that is committed to eliminating malaria in the next 5 years. Highly aspirational, but a wonderful goal. And if there's a possibility of engaging those individuals that have a clear strategic remit, there's then opportunities to advance the profile of digital coordination and digital activities through those partnerships. The next is specifically engaging the groups that are deploying technology independent of digital coordination efforts. So having spoken to a number of countries, there's often one or two ministry teams that you might be finding out after the fact that projects are deployed, or that there's duplication of functionality in a specific health vertical. Those teammates are good allies and very good administrators of the DHA, because you can get more information that's in real time and connected to those breakdowns in communication. The next is, where possible, to engage NGO help. There's a increased pressure from donor communities and from private sector partners to have a reduction of duplication of effort. So this actually should say NGO and private sector where possible. I wouldn't necessarily recommend giving those individuals overall site admin, but you might want to consider having them as viewers within your Ministry of Health page. As a clarification for individuals on the call that have not had the DHA oversight and training, please feel free to reach out to me. The session today is focused on the next step after you have a basic understanding of the DHA site. So if some of this is a little too detailed, please feel free to reach out to me. I have a site demo that I can share with you, but we won't be covering the full functionality of the site today. Instead, we're focusing on how to set up and establish and deploy the DHA in your country. Next, looking at how to gain DHA system admin certification. So the DHA global team has devised a very basic competency exam of sorts, where you complete a number of tasks and share those tasks back with our team. And then you are provided with a formal certification from the WHO that says that you've achieved the requisites to be able to certify a Ministry of Health site and to oversee the Ministry of Health functions within the DHA. These individuals, again, should cross health and technology areas where possible. It's not a highly technical role. It's fairly basic. It's more like setting up a website and administering the overview or the governance pieces that you've enabled on your digital health atlas. 3 to 4 high-level site admins are ideal. There's below the system admin, there's also a site admin and then a viewer. But I'm talking about the individuals that will be at that system admin level. And we will also be updating the certification routinely. So the individuals that are site admins for a country are part of a communication strategy from our team to keep updating you on new features and to help you to provide feedback and help us to prioritize the right features within the product roadmap. So this group is key from our side, because we want to have a focal person as the WHO globally that we can be briefing on the progress of the product. As mentioned when we were providing the initial training, the Digital Health Atlas will be used as as one of the WHO's key products to support governments in coordinating their digital health programs. And so this is a way that we then connect directly with your team. So it's really ideal that we could have those 3 to 4 delegates in place and properly trained, and then within the user group. The next is preparing a briefing for leaders. So it may seem a little out of step to start with the core group and then to move on to a briefing for core leaders. But you want to have enough knowledge within your team to run a demo if you're asked, to be able to respond to questions around the security of the site or the design of the questionnaire. And so even if that core team changes and there's a shuffle at a later stage, it's really good to know first and foremost have a very detailed understanding of how the site functions. So when you're preparing this briefing, I have a number of samples, and I'll share this with with the AHAN leadership team after the call. I've prepared a Google Drive with some resources for you. It's good to mention how the DHA has been approved as a mechanism by the WHO at a global level to advance coordination of digital health programs, and also to focus on local alignment where possible. If there has been a recent objective to advance coordination of digital health programs or reduce duplication or use digital health to achieve universal health coverage, or if there's a clear digital health policy that needs to be complied with. Those are some of the real opportunities to help advocate for the use of the DHA. And then finally, to ensure that the leaders feel empowered to engage or delegate a member to join the DHA team where necessary. A question that we often get when you start to brief higher level leaderships is, how could something like the DHA be used to coordinate activities beyond just health? And we recognize that that's a functional requirement. There's many times the Department of ICT that looks at shared infrastructure and shared assets that could be used for fintech or ag tech or ed tech. And I'll cover this in more detail when I look at how this what the new features are for the Digital Health Atlas. But there is now going to be the ability to fork the DHA code and to create customized taxonomies. So if you do have a vision as a country to create a more broad registry of all innovation so that there could be shared learnings or shared infrastructure between different ministries, then just know that that's something that we could be talking about, and I would be very interested in having conversations with you. And finally, to brief the leaders on key issues that will come up. The first is often verification of projects. So ministries want to know that there's the ability, leaders want to know that there's the ability to clearly stamp or approve a project that has met certain requirements or that is in compliance in terms of policy. So it's good to share that ahead of time, that this is a functionality that's supported. And also to note that the ability to customize the questionnaire and view private responses if there are more sensitive questions is only accessible after the approval of the Ministry of Health. And then finally, to overview how the questionnaire can be very easily changed. So there's a recognition that you might have dynamic information needs, and so just note that it's not something that the WHO controls the frequency of or the content of outside of the core questionnaire. That's something that only your team designs and approves. And then it's to look at a more detailed concept note. So once the briefing and subsequent required approvals are in place, then this concept note actually is often more aligned with an operational plan. So you'll want to look at a governance model, preferably one that is, again, in line with strategic goals, aligned with policy objectives, and aligned with evidence requirements. So especially if you're looking at the achievement of universal health coverage, this is an opportunity to consider what the data that's collected could do to enhance your understanding of achievement of these goals, or to identify gaps and look at opportunities for additional investment, either from your ministerial team or from external sources. Aligning with other assessment tools where needed. So the DHA Digital Health Atlas does not provide any sort of measure. So it doesn't look at, it doesn't give you some sort of a score of projects. That's an additional step. So countries like Sri Lanka have used the MAPS toolkit, the mHealth Assessment for Planning and Scale toolkit, to conduct a secondary analysis of the relative maturity and readiness for scale of projects. And that might be needed depending on your goals and objectives for use of the DHA. So this is a good step to look more broadly at the other assessments that are available, to know if there's a mechanism that you've used before that you trust, and to take that step beyond registry to look at some sort of concrete number that could help you to understand if the project is something that you want to invest in or something that you want to approve. And then to look at the questionnaire design itself. So if you want, you could merge an assessment tool with your questionnaire and you could have that be conducted in this at the same time if there's compatibility. Or you can just look very broadly at what needs to be understood. Some projects want to look at the coverage if their goal is to have national scale of a specific type of software functionality. Or they would want to look at underserved areas or mobile network operator coverage. So this questionnaire really needs to feed those informational needs. And you can do some beta testing with it. You could send out the questionnaire to a smaller group or use a Google form initially. The DHA does have a bulk import capability, and the other option is that you could bring in historic data and analyze it through the DHA and look at those gaps. So there's a couple of different ways that you could basically approach the data collection activities within the DHA and overview that in this concept note and operational plan. The next is to ensure that there's agreement on the schedule for updating project information. There is a timestamp of the data that's collected through the DHA that's available when you export the data, but it's right now we don't have any sort of a reminder mechanism, but it's a feature that we've thought of. So if you wanted projects to be updated on a quarterly or annual basis, it's good to decide that early on. If you're using the Digital Health Atlas to align with the technical working group, then my recommendation is that the projects are updated at the schedule of that technical working group, potentially a week before. And then you could, if you had a group that was meeting on a quarterly basis, you could request every 8 weeks that the projects are verified and updated. And that's the next step, is to decide whether to use this project verification process. So to be clear, on the DHA map, there's a filter that shows approved projects or verified projects. And this is a feature within the Ministry of Health site admin that you can then use. The next key piece to include in your concept note is a detailed overview of the data collection model. So this falls under methodology. It's ensuring that there's a level of institutionalization of these concepts, the concept of a health system challenge, of the digital health intervention, and then of the application category. And the model here is very similar to the idea of having a diagnosis for a patient. So the initial health system challenge is what is wrong or broken in the current health system. The next is how the software platform or application system is meant to solve that problem. And then the application category is how the ICT system that delivers one or more of the digital health interventions is linked to this program. And so an example here is a problem like loss to follow-up for clients. The software system that has been deployed offers the functionality of transmitting targeted alerts and reminders and longitudinal tracking of client health. And then those are linked to the broader health system categories of client communication systems and electronic medical records. So it's worthwhile. Some countries have actually even run a small in-service training to help, especially the core ministry team, understand how to use this information, and then to look at how this might need to be aligned with your own policy wording and the descriptions that you use internally to share information. So this is what would you call it, a classification framework that will be updated in the coming years, but for the most part, it will just be an adding on. So you will see an update of this, and just to open the door, there would definitely be welcome feedback if you have application categories or digital health interventions or health system challenges that you think we've missed. So just a small plug for additional engagement. Finally, designing the initial questionnaire. So we have compiled an anonymized set of example questionnaires for review, and I'll share this again in the resource folder. So if you want to look at how other countries are structuring their initial questionnaires, we'll share that with you. It's key to note that the questionnaire can be updated very easily. So it can be done with about 2 seconds of effort. So if you find that there's a question that's become confusing, you're able to delete it. You can't edit once you've saved it. You have to re-enter the question. And just to note that if you do delete a question, you want to download the responses before you delete it. Otherwise, we'll have to pull that from the back end for you. And if the project verification is in place, you'll want to ensure that the questionnaire answers all of the informational needs of the approval process. So those are some very, very high level design considerations. We've seen for the most part that countries aren't changing their questionnaires very frequently. And some countries just use the standard DHA questionnaire. Next, looking at designing a communication strategy. So this is then going beyond your internal ministry group and looking at implementing partners, private sector, public sector, and research and academic communities. So there is an opportunity here to build a bridge with your academic partners and to think of ways to share the findings from this governance approach to the broader digital health community. In the coming years, we're going to see an increased focus globally on the governance of digital health programs. So having the opportunity to document and clearly note what has happened and what's changed and how you're using the data in your governance decisions. There's going to be some great opportunities to become a leader in this field because right now there's a gap in this area. So first, when you're looking at this communication strategy, you'll want to ensure that the DHA is clearly linked to the Ministry of Health goals. If there is a strategic plan or a digital health strategy in place, the DHA and the data from within should align with that. And also to look at how, if the DHA is being used for compliance, to link the registry data to a metric or some sort of a decision around the viability and compliance of the project, that is clearly noted. Often these should be very basic visual summaries, and they can be updated over time. If any of this can go on the Central Ministry of Health website, that's also ideal. There's also the ability within the DHA to port the data from the DHA to another site. So the communication strategy should also note whether or not the data is housed within your Ministry of Health site or whether it's something where people have to go to the DHA itself. And that's a decision that you can change over time. So if you want to start by just using the DHA as your hub of information, that's great. Or you could link the data directly to your own site if you have a streamlined communication strategy already. Next, as noted, to consider publication of your internal DHA model through local academic partners. And then again, I'll keep bringing this up, but if there is a project verification process in place, you'll want to ensure that the schedule for updating projects, a summary of the governance model, and the individuals that are part of the review committee are noted. So that wraps up the high-level overview of the process to move the Digital Health Atlas from a concept or an idea to an actual deployed digital health project registry. As I mentioned before, this can change the order can change depending on your country or on the teams that you're working with. And I do want to note that, as mentioned before, there's increasingly donors and investors are providing funding for governments or co-investing with governments to help to align project activities with your strategic plan, and the DHA can be that mechanism. So I would encourage individuals that are considering using the DHA to approach key leaders that are investing in digital health and to see if there are co-funding or co-leadership opportunities for that. So I'm not going to go into the site itself, but just briefly for those that didn't join the last presentation, the Digital Health Atlas itself is the registry where the projects are recorded. That's the 32 to 34 questions. Then all of the data is published to the map. Right now we have data from just over 90 countries, so it's currently the most comprehensive project registry globally. You can export the data from the site, you can contact the project leads from the site, and you can also export or save filters or searches if you wanted to analyze different trends in the DHA over time. Next, we have a document and resource repository where you're allowed to upload surveys or research or best practices and share that with the global digital health community. And then finally, the MAPS toolkit. As mentioned, this is the self-assessment toolkit to allow project practitioners to see how they're doing and how ready they are for scale and to understand their areas of weaknesses. So on a very high level, I wanted to also walk through a number of case studies just to help practitioners think about what model might be best for them. So one model that we have seen a country use is looking at alignment with policy directives. So there was a Ministry of Health request for an overview of the DHA, of the digital health investments currently supported by the ministry. So this is an example of a very targeted process where there was some hesitancy at the senior leadership level within the ministry that there wasn't sufficient oversight to digital health programs. And so there was an internal audit where the teams from the Ministry of Health of Lesotho documented and interviewed the leadership just within their ministry team. And then the DHA was referenced in partnership with the ministry and then also donors to understand what needed to happen to advance these programs to additional scale and to understand which programs weren't sufficiently resourced, which needed additional human resources and support. And then understanding how the programs that were in place could be linked to other health program areas that had a need. So they had a very significant focus on HIV as a country, and there was a feeling that a lot of the functionality from the HIV specific programs could be linked to other project activities in other health vertices. The second example is looking at supporting the technical working group mechanism for mHealth. So the Ministry of Health in this country had a quarterly mHealth technical working group meeting where implementing partners would come and share. There would be a presentation and an overview of the deployment and geographic coverage. And then there would be the communication back from the ministry around new directives or funding opportunities or partnership opportunities. And the DHA was the registry for projects to register before they were allowed to join the Ministry of Health, and that verification was then provided and then they could join. So that's a very basic overview. The next is looking at aligning with e-health policies. So there was a facility level inventory that was done offline. So that was not using the active DHA questionnaire, but using an external application software. And then the data was ported into the DHA through bulk import. The national academic partnership has been established, so between the university team and the Ministry of Health team, for a testing lab to be stood up to understand how the software is compliant with the e-health policy directives. The major concern had to do with patient level data and to ensure that there weren't any, I guess you call them leakages or weaknesses in the software that was handling patient data. And then those software systems that were compliant would be formally approved. So that wraps up a very, very high level overview of the process for deploying the DHA, the site functionality itself, and then also a few case studies that we've started to work on as a global leadership team. Before we wrap up, I'm just going to talk through the new features that are planned in coming months. And so the first is that we've recognized that there's a real need to be able to use the data from a registry, or the Digital Health Atlas data and the project registry with the development and verification and ongoing monitoring of your digital health strategies as a country. So there's a plan to develop an investment roadmap module that would extract data from the project registry process, align it with the larger components of the e-health architecture for a specific country, and then create visual summaries that would help ministry teams and investment teams to understand quickly what the current state of a country was. So to identify gaps, to identify opportunities for investment, and then to identify the compliance with that specific policy or specific strategic vision. So we're doing a needs assessment in partnership with the Ministry of Health of Sri Lanka and Ministry of Health of Bangladesh. We'll be delivering a very rough V1 and some conceptual sketches, or wireframes, excuse me. And then we'll be delivering a V1 of that module in the DHA by the end of this year. So there's a plan to be able to use this inventory data in your ongoing monitoring and adherence activities to ensure compliance between your strategies and the current state of the applications in country. The next major feature is integration with external sites and external evaluations. So right now there's different tools for evaluation in a country. The Global Digital Health Index is one, the Measure Interoperability Assessment is another. And so we're understanding those linkages and creating a way for ministry partners that have completed those assessments to bring that into their DHA environment and have a bit of a hub for all of your data. And then the third is looking at that ability to create additional customized classification frameworks. So it's extending the ability to use the registry for more than just health. And we don't have a timeline for that. It's being developed by an external partner that's using the DHA and has forked the code and has started to build customizations. So if there's any groups that wanted to be a part of that, it would be great to have the chance to learn more. So those are our very high-level features that are coming. I think I'll end. I've gone fairly quickly, but I wanted to leave a bit of time for questions and then understand if there's more gaps or more information that we needed to provide. I had mentioned briefly to the AHIN team that there's a number of investor groups that are looking to the DHA to design their digital health strategies and their investment roadmaps themselves for the next few years. And so if there are groups that are considering highlighting a few key projects, it would be great for you to do that before the end of August, because we foresee those investor groups looking in the next few weeks, and especially if ministries have projects that they want to be showcasing, it would be great to have them in the DHA so that the external investment partners can see the programs that you really want to highlight as a ministry team. So I think I'll wrap up there, hoping that everyone heard everything, and see if there's any questions or feedback.
Right, thank you, Ms. Megan. So to all our participants, we're now open for questions. Before reading the first question, Dr. Alvin says thank you for explaining the Digital Health Atlas to our members and for tirelessly sharing your time with us. We know it takes several times for concepts like the DHA to be understood by stakeholders. Right, so the first question, Ms. Megan, is will there be a way for the DHA to also reflect how the eHealth projects comply or conform to standards such as HL7 or IHE?
Yeah, that's a great question. It's a concept that we're exploring in the investment roadmap module. So I'm also talking to experts in eHealth architecture. I'm not one myself, and there are questions around FHIR compliance or HL7 compliance. So to answer, we would love to be able to build that, but we need some help to understand what kind of information you would need, how you would trust that information, the frequency of the verification, if this is an automated process. So to whomever answered that question, if you wouldn't mind sending me an email, I would love the chance to speak with you and understand more around how we could support that use case in the DHA. But it is one that we're actively considering, if not in the first version of the investment roadmap module, it would be in the second or third, we're hoping.
All right, the next question reads, some Ministry of Health staffers are very busy to actually manage their DHA directly. Are there models where MOH outsources the DHA systems administration to non-MOH stakeholders like the academe or an NGO?
Yes, that's a great question. I actually just had a call with Romania today on that exact model. So the academic institutions that partner with the Ministry of Health are actually overseeing the DHA in Romania. And then there's a number of countries that I won't name, but that have used the DHA through NGO partners for the initial setup, data intake, and then routine reporting updates. And I think that now that the API out feature is ready, there's also some ways that you could look at automating information. So it would be really interesting to see if we could move away from someone having to continuously log into the DHA. That's not the model. The model isn't for there to be site traffic. I don't get a bonus if 10,000 people go on the DHA, but it's instead to have high quality, verified, trusted data that's easily accessible for decision makers. So it would also be great to think not just of the administration of the DHA, but the data ingestion of the DHA for ministry partners. But to very briefly respond to your question, yes, it's definitely a model. If you want to do that in your country, you just have to let me know and provide a letter of permission. And then to delegate the right person from academia to be the site admin and to represent your government in that way. NGOs, I think it's the remit can be, we found that the remit is often bound to a specific project. So it might be that that's a 6-month period where there's a hand-in-hand model, but long term, it's hard to have an NGO be seen as the representative of the Ministry of Health. It's usually, in order to gain traction and be seen as a legitimate source of Ministry of Health governance, you need to have that linkage to the government long term. And it's questionable in my mind if an NGO is the right group to do that. But ultimately, we as the WHO, we just support whatever model you need as a ministry. We'll provide training to whomever you request, and we'll provide resources to them, and then you can work that out within your own team and hopefully share with us the insights so that could be something that other countries could learn from. I do recognize that you're all more than incredibly busy, and so this shouldn't be something that's an additional burden in your everyday lives.
Thank you, Ms. Megan. The next question reads, other than site admins, which other functional roles are recommended for a typical country-level DHA team organizational structure?
That's a great question. The site admin is the one that can update the customized country page, that are able to approve or verify projects and to verify the map data. And there's actually 3 roles. So the group of, one role would be the team that would look at the appropriate map level of data. So the DHA supports 3 levels of map data: national, subnational, which is bound and visualized on the map and is linked to GPRS, and then the 3rd sublevel, which could be a master facility list or just a subnational level. And that can take a surprisingly long amount of time to agree, to think through how projects are linked to geographic regions and how that links to what you need to know. So that's definitely a key role. And then also to find the files in the right format that currently represent your country. And so that again is linked to either updating the map on OpenStreetMap or working with our team to get the data in the right format and everything spelled correctly. So that's one key role. In terms of additional roles, questionnaire design is quite key. So someone that could work with and between your health teams and your digital teams to ensure that all their informational needs are represented, and that the questionnaire doesn't get so formidable that no one can complete it. So striking that key balance between getting all the information that you need to know and then having it present in the DHA. A third potential area is local translation. So the DHA does support dynamic content translation. It's an arduous task, but we translate the DHA into the UN approved or the UN global languages. But there is the ability, if you wanted to look at, translating it to Nepali or to Thai, like there's the ability for you to do that. It's an additional step, an additional customization, but we wanted to make sure that countries could use it in their own languages if possible. And so that's definitely an area that if you want to do that, it would be a good idea to have a role that was dedicated to that. And what's cool about that is that you could also then be translating all of the DHA global content, like the digital health classification framework, to a more accessible language and format, and then be further institutionalizing that language and that concept in how we're talking about digital health program and digital health evaluation. And then the next is to, if you wanted to look at maybe porting the data to an additional site. I know this is getting a bit technical, but if you do have, and many countries do, you probably have more more dev resources than I do. And so either customization of the code for your own use cases or looking at how the data from within the DHA could be further visualized and analyzed to align with your information and planning needs. That's definitely a team that you could stand up, or just consider adding, that to the role and remit of an individual from within your ICT team or your technical software development team.
All right, thanks, Miss Megan. We have another question. It reads, we have completed our roadmap and guidelines, so what should we do further for the DHA?
Great question. If you can get in touch with me and share those, the idea from kind of mid-year this year is, or sorry, mid Q4 of this year, is that you would be able to share that roadmap within the DHA and then to align your evaluation of the achievement of those roadmap targets with the data from within the DHA. So initially, your first step would be to select a core team and to work with me on the certification of that core team. But then we can look closely at how the Digital Health Atlas could enhance the attainment or the achievement of your strategic goals, and how it could be used to help your team to monitor that achievement over time. So I think you're at a really great point to start to look critically at the applications that are present in your country, and then to think through what investments are needed to scale what's most important to you and what's most strategic in terms of the vision for your country.
Thank you, Ms. Megan. We have another question. What APIs are available to stakeholders, and how do stakeholders request for additional functionality in that regard?
Great question. The API out is for the data within the DHA. And I'm not technical, so if I'm misstating this, I can connect you with our dev team. And then to also bring data into the DHA. So right now it's just the integration or the linkage between your data set per country or per disease vertical and an external site. And then if there's, I think at a later stage, there would be additional data available, but right now the API is just a linkage to the raw data from within the DHA on a scheduled basis. Right now, it's the team that's using it updates once a day, I think, at the end of the day. And if the individual that would like more information can send me an email, I'll connect you directly with our dev team and I can add you to the Git repo for the code.
Yes, thank you, Ms. Megan. Dr. Alvin says AHIN is helping set up interoperability labs into a community of interoperability labs, hoping we can equip them with DHA capability so they can be a go-to resource for the ministries of health.
Yeah, that would be wonderful. I think that interoperability is a key, it's a key consideration. And right now it would just be raw project data and compliance, but you could look at your questionnaire specifically focusing on issues of interoperability. And if it's aligned with that sort of group or group that has that type of a remit in a country, you could look at ways to use the DHA data to assess achievement and like practical outcomes linked to interoperability, what type of data was exchanged, what frequency, and then looking at how, what needs to be built in order to achieve that, what sort of architecture components are missing. So that's, and also the other piece that we've been thinking of with the interoperability lab is to look at best practices, like to look at interesting ways that countries are solving problems, like what sort of middleware, what sort of registries, what sort of, I mean, I don't want to sound like I'm trying to be technical, but I think that it's such an interesting problem that we don't have enough information on, and we would really love the chance to work with your team on, maybe even advancing the standard global questionnaire so that there was sufficient data to know enough to be able to document these models that are actually working that other countries could reference.
Thank you, Ms. Megan. So one of our participants wants to say he's commending the DHA for being a nifty knowledge management platform. And then
Thank you.
adoption of the DHA in
Sorry, I just lost the audio there for a moment. Could you repeat?
yes. Aside from these webinars, what other help do you need to increase adoption of the DHA in Asia?
I think the main piece is looking at how we could align with national activities around coordination. So if countries are planning to develop a digital health strategic roadmap or strategy, to think of ways that we could be institutionalizing the use of the DHA as a resource, not just for an initial one-time questionnaire, but also for ongoing monitoring. That's right now I see the biggest gap. We have a number of countries that use it as a snapshot of a specific time in response to a specific information need. But it's that question of ongoing governance and understanding from your team side, from different groups on the phone now, how could we be connecting with groups that are both interested in knowing what's happening immediately, but then also looking at how we can embed the DHA with that longitudinal governance, like governance over time and sharing of best practices, and being able to look at how the type of software in a specific country could be customized or added to the portfolio of another country. So if any colleagues on the call have ideas around this or groups that we should be in touch with from within the global WHO team level, that would be great. And also the regional lead, Mark Landry, who I'm sure everyone on the call knows well, has actually invested in a DHA support role for the Asia region. So there's the chance to have more advanced training with that individual who will be based out of Sri Lanka. And so we'll be in touch with his details, and we'll be looking specifically at more advanced documentation needs and the chance to look at case studies that we could publish globally that will help to highlight how your region and your countries are handling the governance of data and the governance of projects and the alignment of program activities with strategy overall in a country.
Yes, thank you, Ms. Megan. I think that's the last question for our webinar. So to all our participants, if you came in late, we will be posting the recording so you can catch up. And thank you for joining our webinar.